Hello, everyone. It's good to see you all here. My name is Chichi Aibe. I'd like to welcome you to the B-Wise Symposium titled Leveraging Digital Strategies to Improve Access to Sexual, Reproductive, and Mental Health. Insights from the South African National Department of Health B-Wise study. Please welcome Mrs. Gertrude Mbalati, the Youth HIV Manager at the South African National Department of Health, who will be giving the official welcome address and introduction.
Thank you. Thank you, Chichi. Greetings to the program director. Warm-hearted, I'm bigger now. Warm-hearted people who have passion of working with the young people in the youth space. We appreciate all the people that are here today. Irrespective of your hectic schedule, you are here with us today. We know that adolescents make up a great proportion of the population in the African region, and South Africa is the youthful population country. Adolescents are in increased risk of mortality and morbidity associated with accident, suicide, HIV, drugs, pregnancy-related complications, and other illness that are either preventable or treatable. South Africa is facing health challenges, especially young people. We still have high rate of HIV incidence, high level of teenage pregnancy, high school dropout, gender-based violence, just to mention a few of the challenges that we are having as a country. The health and social problems are interconnected and are driven by biomedical, social, behavioral, and structural factors. It is a fact. Currently, we are in the fourth industrial revolution as a country of South Africa. We are aligning ourselves with our new developments that are in place. Our National Adolescent Youth Health Policy, the first objective in the policy is the use of innovative, youth-oriented programs and technologies to promote the healthy and well-being of adolescents and youth. That is where our B-Wise is born. Our B-Wise is a digital platform aimed at providing youth of South Africa with access to free, accurate, non-judgmental information about sexual and reproductive health and rights and other related topics. The Department of Health is trying very hard to make sure that young people access health-related information in a comfortable space. B-Wise is a Department of Health digital platform, but we are not working alone or in silos. We have partners that we are working so that our platform is more user-friendly and acceptable by young people. We have a lot of expert partners that we are working with currently. I want to take this opportunity to thank Rich Digital Health with the support that they had from Elton John AIDS Foundation for conducting a very successful survey on the B-Wise chat box. That's why we are here today, because they are going to give us the outcome of the survey that they have conducted. Thanks again for sharing the outcome with us and awarding us that opportunity to have a robust engagement on the outcome of the survey. We are really looking forward for the outcome of the survey. All of us that are in this symposium, this is our symposium. Let's participate and enjoy the symposium. We are all welcome. Thank you.
Thank you so much, Madame Gertrude, and to the National Department of Health for your amazing support, your leadership, and for taking this initiative to the next level. We're equally thankful for your time and for your own divided support and efforts that you've put in this. My name is Carlos Gerena. I'm the Director of Partnerships and Growth at Reach Digital Health. And I'll just get us started into why are we here? I think we've all heard from Madam Gertrude what the B-Wise Young Africa Live system is trying to achieve. But I'll take some moment to really introduce what the system is really all about. But I'll start with taking a little bit of a step back in terms of referring of the digital technologies and how they do play a pivotal role in improving health outcomes for youth in Africa and in general. But we really believe that by enhancing access to the information, facilitating engagement, and ensuring confidentiality, we can provide real-time support programs such as the Young Africa Life under the B-Wise umbrella, because we believe they can significantly contribute to the health and well-being of young people. There's no doubt that the scalability, the cost effectiveness, and the data-driven approaches that these solutions have can ensure that more youth can benefit from vital health information, support, and ultimately leading to healthier communities in South Africa, but beyond. A little bit of the partners that you will hear from in this symposium are represented here, and we're really thankful that we were able to really come together and put this initial idea and goal to make it a reality, and now we're able to speak about it. Let's speak a little bit about the problem itself that we're trying to solve, and that is that we all saw that Young Africa Live as a transformative initiative to empower young people in South Africa, but also in other developing countries, to take control of their health and their well-being. We believe it is a beacon of hope, aiming to really overcome the socioeconomic barriers that Madame Gertrude referred to, that often hinder access to crucial sexual and health-related information, as well as services. And so specifically to this approach, we focus on group age of 15 to 24. And we really believe that by doing so, we can pave the way for these young individuals to live a healthier and more fulfilled life. Moving forward, I think the invaluable support of the National Department of Health, as well as the Elton John AIDS Foundation, was good to really leverage the technology that Rich Digital Health for 16 years now has been trying to put in the hands of different users and people. And so the idea was to have something that was available, something that was personalized, but also simple to understand so that we can have the biggest impact that we could. And so moving forward, the system is not just about understanding and addressing young people's needs. I think we can move to the next slide, sorry. As a whole, we really wanted to have an accessible digital tool that could cater through different channels and through different ways these sort of topics that in many ways are difficult to speak to, hard to access the right information. And so we really tried to use a multi-factor approach in which young people were able to access the information through popular platforms like WhatsApp and Facebook to really deliver tailored dynamic information, advice, as well as support, coupled with directing them to specific services that they could access. The platform, if we can move to the next slide, the platform was designed to be user-friendly, allowing users to really switch seamlessly between private conversations to a smart bot, chatbot, or IP messaging, as you would like to call it, through WhatsApp, but also have open discussions with the peers on Facebook whenever they need it. And so there was this cross-channel feature that I think really helped us to engage at those two levels, the different audiences. Moving forward, if we move to the next slide, I think some of the feature interventions were really aiming to create knowledge base among young people. And this included, different forms of doing so, from scheduled messaging to what we call ask a question, where users could be able to input specific questions on text freely, as well as browsable content. We really wanted to ensure that the knowledge base was addressed. Ultimately, we wanted to increase demand for and linkage to high-quality adolescent-friendly sexual and reproductive health services and products, which we address with features such as the service finder, all the direct access to the Love Life hotline service opening really the door for more on-the-ground intervention in the future. The rollout of B-Wise in South Africa, the study conducted for which we will be releasing the results today, and what this means for rolling out similar initiative with partners in other countries will be what we will be addressing going forward. So here you have, if you want to test it yourself, how can you send just the word hi, and you can start chatting with this amazing platform. I will now introduce a very good friend of mine, somebody that has really been in the forefront of this work from a monitoring and evaluation perspective, really ensuring that the work that we do, it's able to be evaluated and the impact that we're trying to achieve is really captured. So over to my colleague and friend, Chris Lemmert, who is the Merle Associate at Reach Digital Health, to share more on an overview of the study, the survey, and the results that we saw. Thank you, Chris.
Good afternoon, morning, everyone. Thank you, Carlos, and the panel. It's a pleasure to be here today. I'm excited to share a number of key findings coming out of Reach's evaluation efforts over the past 2 years, and the implications it has for the platform going forward. I want to, ahead of time, apologize for going a bit quickly through this presentation. There's a lot to synthesize from a 150-page report, but you can always receive that full report that these slides are based on by emailing any of the Reach team members here today. Okay, before jumping into the results of the study, I want to quickly outline the key questions that we aim to answer as a research team. So, a substantial number more than these were tackled in the full report, but this presentation is going to be focusing on 4 primary questions. These being, how effective was the program at giving young people access to the knowledge base of SRH information that Carlos alluded to, as well as how effective was the program at increasing demand for and linkages to SRH services, its provision of a safe forum and space for young people to discuss SRH issues, and ultimately its ability to improve sexual and reproductive health behaviors, knowledge, and attitudes. Okay, so going to the next slide, in order to answer these and more questions, the Reach team, with the invaluable oversight of the Elton John AIDS Foundation, employed a contribution analysis style evaluation, combining evidence from multiple data sources to try answer and identify which nodes in the platform's theory of change were substantiated and which were not. On screen, you have a number of data sources that we used to compile the report, but I'm going to be interleaving these throughout the presentation and explaining them as we go. Before doing so, I just want to caveat that these represent an attempt to measure the first incarnation of the B-Wise service. The methods employed can only speak to correlations for now and qualitative interpretations of the data. We're not yet making any causal claims. However, this does not represent the end of research for the project, and measures into specifically accounting for causal interpretations of impact will likely happen under further iterations of the program as we expand and improve on the service. Cool, next slide, please. So the first set of results and data type we're going to be looking at are results coming from the WhatsApp and Facebook platforms. Now, platform engagement data is data that's automatically generated by either the WhatsApp or Facebook system for all users simply by their engagement with the platform. It's one of the advantages that digital health programs have, where we can track user engagement very specifically. Okay, turning to the next slide. And so starting on the WhatsApp side, what we found was that in terms of the total number of users reaching the WhatsApp line, the program was able to achieve its relatively lofty goal of having over 100,000 unique cell phone numbers messaged the line. Additionally, there's evidence to suggest that as many as 97,000 are likely to have been youth aged 15 to 24, the target age demographic, demonstrating that the effects of the consortium in partnership with Meta were able to effectively drive users to the platform. The last thing I'd like to discuss on this slide is that I'd like to draw your attention to the ratio of the last 2 bars to each other, which is looking at the number of people offered to join for push messages, an essential part of the program to having users experience long-term SRH content exposure, and those that ultimately consent. Here, this is 73% of people that are asked ultimately consent, but because this is at the end of an onboarding process, that's substantially lower at only 42,000 than we think could have been achieved by just having this question front-loaded at the beginning of the onboarding process, where the number of people receiving consistent SRH content could have been as high as potentially 75,000 users in this case. And that's a change that's already been implemented in Reach's other work on our platform onboarding system. Okay, going to the next slide. Okay, so now before describing users' continued engagement on the WhatsApp chatbot, it's worth understanding that high bounce rates and sharp initial drop-offs in users are characteristic of all mHealth applications. This is something that needs to be known just about the type of platform we're engaging with here. Indeed, in their meta-analysis, Pratap et al. 2020 find that across 8 mHealth interventions, the median engagement is just 5.5 days. Similarly, on our WhatsApp line, we see a sharp drop in user engagement, with 25% of subscribed users retained in the first 2 weeks of the program, before this levels off to around 10%. Note that this fits within Pratap et al.'s industry findings, and in this regard, we're somewhat pleased with the result. However, we believe there must still be room for improvement, and this is going to be a central focus in the phases going forward. Okay, next slide, please. Then there are a few other platform data that I'd like to speak to just on 3 other key features. So on the WhatsApp side, we note that there was low awareness and uptake of the service finder feature, a way for people to find clinics related to their needs around them. However, the service was deactivated during the implementation, and therefore reactivating the service and improving users' knowledge of it are key goals for the team. Unfortunately, we found that fewer users used the mental health screening tool than anticipated, hence greater flagging of this is necessary. That being said, over 1,900 users, close to the initial target, used the Love Life Call Me Back feature and were therefore successfully referred to a counseling service, which we see as a major achievement of the platform. Lastly, turning to the social component of the intervention, the B-Wise Facebook page. While the reach of the B-Wise campaign was very large, we didn't find sufficient peer-to-peer engagement occurring on the Facebook page and through the adverts associated with it. As such, the platform will need to strengthen its social component and its envisaged mechanisms for peer-to-peer discussions in future iterations of the platform. Okay, going to the next slide. Now I'm going to discuss results from our pre-post study, the study that Sister Gertie referred to earlier, where between the 31st of May and the 7th of June 2023, a subsample of users meeting some eligibility criteria were invited to a pre-post study. 502 ultimately completed baseline and endline. And before going into describing the outcomes, I just want to quickly note that these 502 users differ slightly from the broader YEL group. For ethical reasons, they're only aged 18 to 24 as opposed to 15 and older, and they're more likely to be female and in a relationship and appear to be more engaged. But that's not to say, so these results aren't universally applicable, but they're still instructive as to what may be possible, and that's the takeaway we're forming from this. Going to the next slide. Oh, sorry, still on the slide, one up. So encouragingly, across the pre-post rounds of the survey, we find statistically significant and large improvements in many outcomes. So using a multivariate regression model, we found improvements of between 33 and 36% of their baseline values in SRH knowledge, poor personal body image, attitudes towards consent in sex, and users' locus of control, which is a measure of agency and empowerment. We also found between 11 and 15% reductions in depression or anxiety and social isolation. This demonstrates a valuable correlation between exposure to the WhatsApp chatbot and improvements in a number of key knowledge and attitudinal barriers, That said, we should note again, these are correlational findings, and two of the findings, which are asterisks in the slides, are not significant under an alternate viable model, but all of that you can read about further in the full report. Going on to the next slide. Very encouragingly, turning to behavioral outcomes, we find that for those users that did not intend on having a child in the next year, condom usage at last sex increases by 22%, which is a very large finding and is significant in all model iterations of the regression. This is incredibly encouraging and may indicate that the knowledge, attitude, and capacity for decision-making changes that we discussed on the last slide may lead to meaningful changes in behavior. Going to the next slide. Now, we don't want to give the impression that everything worked. There were a number of outcomes where we'd have hoped to see a change but didn't. These include attitudes regarding sexual positivity and gender equality, and behaviors such as general contraceptive use, testing for STIs, and sexual exclusivity, though there may be ceiling effects on the last two. These represent outcomes where we'll continue to iterate on the platform design to potentially see if we can shift these further. Finally, while this presentation has largely focused on what quantifiable evidence can be found for impact, I want to quickly reflect on evidence of users' experience on the platform. Next slide, please. From the pre-post study, we find that 73% of respondents thought that the chatbot content was either very or well reflective of their sexual needs, and 88% of respondents indicated that the content was either very or quite useful for managing their sexual and reproductive health needs. So this is quite encouraging from that sample. And going to the next slide. We also found that from 9 focus group discussions that an external research group, ASAP Consulting, conducted, I want to focus in particular on the finding they get where users reported feeling more empowered to speak about sex, intimacy, mental health, and negotiate for safer sex practices. So ultimately, we would say, while not all nodes of our theory of change were supported by the evidence, we're greatly encouraged by what results have come out of the study, providing provisional support for the platform's ability to provide information for young people, have that information translate into improvements in some key changes in knowledge, attitudes, and behaviors, noting all the caveats that we mentioned, and the ability of the service to link to a meaningful number of people to the Love Life Health services, though there's potential for greater referral systems to be integrated in future rounds, and at least the desire among young people for a forum for peer-to-peer engagement, which will be iterated on in future implementations of the program. So yeah, this covers a lot of what we wanted to speak about, and as you can see, there's a breadth of research to be dug into here. So this reflects the key takeaways we'd like to share today. As mentioned previously, please feel free to reach out to the team by email to gain access to the full report and with its many annexes. So thanks again to EJAF for their assistance on the high caliber of the research. And I'd now like to hand over to Sarah Hand from Avert to present the research findings they generated from a content perspective.
Many thanks, Chris. Thank you, and hello to all. Good morning, good evening, good afternoon. Next slide, please. And next slide again. Thank you. Great. Okay, well, it's lovely to be here today to talk to you about the B-Wise chatbot and the social media project. I work for Avert, a digital comms organisation focused on increasing sexual health literacy and supporting informed choice. Avert's role in the B-Wise project was focused on developing the chatbot content that Chris has been talking about and developing the chatbot social media promotion and recruitment and engagement strategy. This included running the paid campaigns on Facebook and Instagram to get people to try the chatbot, as well as developing and running the campaigns to engage young people in the discussions on Facebook and Instagram around the themes covered across the chatbot. This was all supported by a substantial level of in-kind advertising credit from Meta. A third planned element of the project was to use the organic B-Wise social media channels to build on the discussions and engagement generated by the paid campaigns, creating a vibrant space for ongoing peer-to-peer discussions. This organic side of the social was led by the existing B-Wise partners here on the symposium today, and not Avert. In the few minutes I've got, I just wanted to focus on a few of the key insights and learnings from the content side of the project. And these insights aren't part of the research that you've just heard from Chris, but based on the analytics and the data that we can get from social that, again, Chris referred to. Next slide, thanks. Great. So what content engaged our young people? Firstly, just to say that the chatbot content covered a broad range of issues from sex, pregnancy, birth control, relationships, HIV, mental health, sex, gender, body image. But we have clear data that shows that sex and pleasure-focused content was the most accessed on the chatbot. Sex-related content was also what grabbed young people's attention on social media and stopped them scrolling on their feeds and engaging. Some more serious topics featured highly in the Ask a Question feature that was on the chatbot, including PrEP, HIV testing and HIV treatment, but also in the top 10 question areas, topics covered enjoying how to enjoy sex, enjoying condoms and sex choices. This is consistent with what Avert has seen across other similar projects, where sex and relationships are definitely the best entry points for younger people when there's wider HIV, SRHR programming objectives. Next slide, please. So what worried our young people? Okay, so firstly, there's still a lot of shame and stigma surrounding sex-related topics, especially masturbation, but we can see that young people were interested in more information around these areas. And while some comments on the posts were negative, the ads had a large amount of click to the chatbot, meaning that people wanted to have a more private conversation about these issues. We also saw that the consent and mental health were topics not fully understood by the audience. There were lots of comments on the consent content on social saying that you can tell if somebody wants to have sex by what they're wearing or their smile. And on mental health, through the mental health quiz, lots of people were saying that, well, if you feel stressed or unhappy, you should just ignore that, get drunk, get high, and not bother talking to somebody. Next slide, please, Sam. Okay, so we also learn a lot in terms of what content formats work and what works best for this particular audience. Carousel, so that's where there's a series of rotating images, worked very well on Facebook compared to short videos. It outperformed short videos by a long run. In terms of overall platforms, again, Facebook outperformed Instagram on click-to-message ads. In other words, the ads directing people to the chatbot. Instagram didn't work so well, and that's much to do with cost, and generally that platform, people stick within it. I just wanted to flag two insights that we also got from our work. Thanks, next slide. The first one really is to stress that, you know, Facebook really is a cost-effective way of recruiting large audiences. As has already been mentioned, the project gained 100,000 users in just 9 months, and we managed to reach a large number of young people in South Africa, chalking up millions of engagements. That means likes, comments, shares. This is impressive data. This was backed by the Endline study, where over 3/4 of Facebook members strongly agreed that the posts were informative, interesting, and pertinent to their sexual health needs. Next slide, please. Lastly, okay, so a second wider insight that we really wanted to share with you all is around censorship. So changes in the social media landscape during the course of the project led to increasing censorship of our sex-positive health education content by Meta, leading to an increasing number of the social media ads being rejected. Rejection of the ads were on a range of topics, from very straightforward topics like condoms and preventing pregnancy through to maybe less talked about topics such as masturbation or orgasm. The decision to reject these ads seemingly was haphazard and inconsistent. There was very little logic to the decision sometimes. And in some ways, what we would see is that, you know, we could resubmit an ad, the exact ad, and then suddenly it would be approved the second time round. Meta was consistently misunderstanding the purpose of the content and deeming it adult content against their community guidelines. We also learned that Meta does not allow content that's specifically focused on sexual pleasure. And of course, this makes effective sexual health education challenging when we all understand the relationship between a pleasure approach and impact on young people. So while Facebook and other social channels offer huge potential to engaging large numbers of young people on SRHR and support their health and well-being, one key takeaway is that there is also a danger that misunderstanding from those running the platforms may hinder these efforts. This seems likely to remain the challenge going forward without effective advocacy to explain the importance of this work. And just to my last slide, I'll leave you with these few comments from the chat on the chat bot from the social users.
Wow. Wow. This is the feedback, the outcome that we were anticipating. I wish I can give a round of applause for the people that gave us the outcome of the survey. I'm really, really honored. Thank you, thank you. I'm really honored here to come back here and introduce our panel for today. And we are really looking forward to engage with our panelists today. Our first panelist, you are going to clap hands for them, please, so that we give them that courage and that oomph. Our first one is the CEO of Rich Digital Health, Debbie Rogers. The second one, yes, thank you. Sarah Hens from Avert Research. We have Ponzo there, Pilan from Soul City. We have David Dallo from Love Life. And I don't want to misspell the other name, Gasha Espinal from Elton John AIDS Foundation. And I'm bowing here because I have to hand over to our capable moderator from Rich Digital Health. Keith, over to you to moderate.
Thank you so much, Gertie. Good afternoon, good morning, good evening, everyone. Welcome to today's panel discussion. It's a pleasure to have you all here as we reflect with the panelists on the findings from the first phase of this B-Wise collaboration. Our focus is to really delve into what we've seen as wins, lessons that we've learned along the way, and talk about some pathways to progress from here. First and foremost, I just want to remind everyone that you can post your questions for any of the panelists in the chat window throughout the discussion, and we'll have a few minutes at the end to respond to those. So please do provide your insights and inquiries. They will help make this session as interactive and informative as possible. And one of the core themes we'll explore today is how digital strategies and the use of innovative technology can scale the impact of youth health empowerment in the future. We've seen some promising outcomes in phase one that Chris pointed to, but there's always room for growth. So our goal is to discuss how best to expand the service, sustain elements that we think have worked, and talk about any gaps that remain. So thank you for joining us, and let's get started. I think it would be great if we can begin the discussion with each panelist just giving their quick reaction to what we've learned thus far. So I'll start with Debbie. So Debbie, can you please share your thoughts on the B-Wise program thus far from Reach's perspective?
Well, you know, it's always very exciting when you believe in something very much, as Sister Gertrude said, and then are able to look at results that show that your assumptions and hopes and dreams have come true. But I think what's really fantastic for me is to learn more about just how much users wanted to engage on the platform, how many people we had engaging. And I think very importantly that I think we had very high engagement rates compared to most other digital platforms out there. And so that really speaks to the value of the platform that we've put together.
Great, thanks, Debbie. Maybe over to Pancho now. Given Soul City's experience in the adolescent and youth space, what do you see as the main learnings for you, for your team coming out of this first phase of collaboration?
Thank you so much, Keith. And I think, you know, what we've learned at Soul City that on the ground, For instance, the questions around sexual pleasure and the stigma that is also behind that, as the presentation shown, that publicly speaking about these issues is often a problem. But when we're doing our on-the-ground facilitations, activations, and even on our own platforms on social media, particularly Facebook, we see that young people are asking these questions, are looking for these answers. And there are not a lot of places where they can get these answers. And what we've seen is that B-Wise, even for us as an institute and as an organization, becomes a place where we direct young people to go and to find this information confidentially in a safe space where they can ask and really engage with the information at their own time, but also to their own discretion. So I think the issues around that is something that we've seen on the ground and also through the years as Soul City has been doing this work.
Great, thanks, Pancho. If we can go back to Sarah, I know you shared some reactions already, but same question to you. What might be your main takeaways thus far from the B-Wise partnership and thoughts on the results that were shared today?
Thanks so much, Keith. Thanks again. And so similar to Soul City and Ponso, really, yeah. I mean, you know, we've been so encouraged to see the improvements in confidence of young people to speak about sex, intimacy, mental health, and other issues with their peers and partners. I think this confidence on its own is important to improving quality of life, resilience, self-efficacy, and we shouldn't always take that for granted. I think I'd also like to highlight that, you know, what the findings say about the useful role of Facebook and, you know, how it can support that peer-to-peer discussion. And I think, you know, despite challenges maintaining a vibrant, organic B-Wise brand on Facebook, the stats show above average engagement with the paid brand campaigns and activity discussions on a range of posts about different issues. So I think investing more in the organic side of brands in future could really create that vibrant community for peer-to-peer discussion. And then, you know, the retention, of course, within that chatbot and giving people that private space to further explore. So yeah, I mean, just, you know, such a brilliant initiative and a great way to continue to build and explore. Thanks, Keith.
Thanks, Sarah. And I think that's a great point to segue over to David from Love Life. I think, what are your biggest takeaways from today's presentation, particularly related to the social component, given Love Life's focus on peer-to-peer support?
Good afternoon, everyone. Once again, thank you for having me on this, Keith. If we look at the, you know, Love Life has a peer-to-peer program for young people, and what that does, you know, it's critical and important for a platform such as B-Wise, especially in the context of promoting sexual health and responsible behavior amongst young people. Because what happens is that young people, what they do is, you know, as we can see from what the study said, young people are more likely to trust the related information that comes from peers who share similar experiences. They share challenges and perspectives, you know. What it also does, and what we found, especially on the ground with Love Life and our peer-to-peer program, is that messages are actually trusted because peers are viewed as trustworthy sources, especially when they speak from personal experiences. They can trust and enhance that acceptance and the adoption of health-related messages. Also, what we find also on the ground is that you know, from a peer-to-peer, it's reducing of the stigma, because peer discussions help to reduce the stigma of embarrassment around sensitive topics like sexual health, and making it easier for individuals to seek information and support. So young people, young people may feel more comfortable and discussing more personal issues in a peer setting because they lead to more open and honest conversations.
Great. Thank you so much, David. So I think, you know, last but not least, we'd love to hear, Luis, from your perspective. You've been so supportive this whole way of helping us work through some of these findings. So from your side, how have you taken these findings and how has the foundation been reflecting on them since we've shared this study?
Hi, everyone. So I hope you can hear me, and I must apologize because, well, technology is not on my side today, so that's why I cannot put the camera. Very convenient because we are talking about technology, right? But well, just to respond to your question, so I think that it's important to first to contextualize the results within the programmatic phases, right? So I think that the evaluation efforts we're not assessing a fully fledged program, but a pilot, right? So in this case, the type of statements and judgments cannot be the same. So in essence, in a pilot study evaluation, the statements that we can make relates to the potential of some of the components and the need probably to correct some of the elements, inviting us to think on alternatives of those less successful elements, right? So also it's important to remark that as a pilot, some of the programmatic elements may change during the pilot implementation, which is totally normal. That's actually the nature of pilots. So having said this, the main takeaway or statements that we can draw from the results that Chris was presenting before is that there is undoubtedly great potential overall in the B-Wise program, while it's also fair to say that there are some elements that may need to be strategically considered when entering in the next phase, right, which is scaling up the program. So we see that the program is quite successful and definitely on engaging the relevant population, and there are certainly some good results when it comes to some knowledge, attitudinal, and behavioral outcomes. There is, however, a need to keep investing on research and evaluation. I guess that to let's say to gauge with the complexity of the elements within the program and how this complexity overlays on the socioeconomic, cultural, and behavioral complexities of the target population. If we want to find the right combination that can maximize the outcomes of the program, right? So this complexity is very important to bear in mind, considering the crucial developmental phases through which our target population, let's not forget that we're talking about adolescents, they go through. In essence, the promising results are pushing us to keep moving programmatic wise, where the engine, if you allow me the analogy, must be researched and evaluation. And I know, just to finalize my intervention, this sounds simple, right? But in fairness, the truth is that lots of other detailed solutions in the topic of SRH fails to provide, which is embracing male activities or at the backbone of the program. So and that happens for many different reasons. But however, and I've been working with the team, with Keith, with Chris, and with others within the team. So I know that the research and evaluation team at Reach Digital is well positioned to embrace with that complexity through cutting edge research and evaluation approach. So thanks, Keith.
Thanks so much, Luis. Great. So thanks for all of your responses to the findings so far. I think given the richness of the panelists, I want to push us to bring in some of your unique perspectives in a broader sense. So if we can just go back to Debbie quickly, in addition to B-Wise, I think Reach Digital Health's main focus is the use of innovative technology, including AI and other digital tools to reach people at scale. So how do you see digital platforms like B-Wise progressing in the future? What new innovations and technologies do you see making a greater impact?
Thanks, Keith. Yes, AI, the topic of the moment, and I think for good reason. The advancements that have been made in AI in the last 18 months have really been leaps and bounds from where we were when we started using AI as an organization back in 2018. So the advent of large language models like ChatGPT has really changed how we can think about engaging via chatbots. And I think it's really going to change how personalized we can be. That's really, really important. You know, we were talking about engagement. We were talking about how the engagement was high on this platform, but every person who we engage for one day longer is more likely to have behavior change. And so we want to continue to improve that engagement, make sure people are engaged over a long period of time. And AI offers an amazing opportunity to do that by personalizing the engagement of each person and by really being able to understand what is the next intervention that we should be sending to this person based on how they're behaving right now. And so I'm very excited to see how that hyper-personalization is going to be working in the next few months.
Thanks, Debbie. Yes, I'm also very, very excited about that as well, given just the many different research avenues that we could take related to personalization and its interactions with engagement and outcomes. So very much waiting with bated breath as well. Sarah, I think going back to Avert's role and the fact that you all led the content development and social media marketing for the chatbot in this instance, but also for other digital youth platforms, is there anything you've learned working on the B-Wise implementation that might be useful for other platforms to consider working with youth in perhaps other parts of the world?
Sure, thanks, Keith. Yeah, definitely. I think that, without a doubt, what came through clearly here, which is very similar to other work that Avert, leads on, is that need to really focus on the real concerns of young people. And by that, I mean, don't come with our own agenda. Young people really wanted to explore issues around relationships, understanding sex, mental health. And it's such a brilliant entry point to then bringing on other relevant sexual health information. And this was really, really central to being able to ensure that, the Pulse and the chatbot content worked. I think for a long time now, for those of us that have worked in the, wider youth or HIV sexual health sector, we come with a sense of urgency around what we think they need to know about. But I think really being led by what they want to hear about is essential. And linked to this then is the importance to remember that young people have access to many sources of information now. I think, Debbie and others are highlighting that, the pace at which opportunity for digital is taking off is enormous at the moment. And so we shouldn't underestimate that young people have choice and they will shop around, they will look around. And honestly, if they don't find the information that they're after presented in a way that they want, which can be challenging for some government-sponsored initiatives, so things like drug use, sexual pleasure, if they don't see that coming across in the brand, then, honestly, because they have choice, they will go elsewhere. But equally, it's so important that we understand the misinformation that's online and how to kind of get ahead of that. Having obviously that opportunity to keep pace with what they're looking for, keep ahead of the misinformation, it's definitely a challenge, but it can be overcome. And I think working on the B-Wise program, helped us really bring forward content that young people want to see. Thanks, Keith.
Thanks, Sarah. And just to add, that came through a lot in the qualitative study that we did as well around the youth, citing that there is a lot of mistrust with different sources or not necessarily knowing if their friends have been informed from a reliable source. And so the idea that this chatbot would be sort of an external, reliable source of information that was confidential and provided a free space or safe space, I should say, was some of the stuff that was highlighted from a qualitative perspective. So very much in line with what you're sharing. Perhaps back to Pancho, Seoul City has a long history of influencing social behavior change and stretches back to the pre-digital era. So now in today's world, how important do you see the ability to use platforms like WhatsApp will be in 2024 and beyond?
Absolutely important. I think for us at Seoul City, the pandemic taught us a good lesson in ensuring that we are able to use digital platforms to continue the social behavioral change work that we're doing. And what we're seeing, and also knowing the penetration of WhatsApp in South Africa, about 99% of people with smartphones use it. And most of those people being young people, it has been important for us to acknowledge that and see platforms such as the chatbot as an opportunity to really reach young people where they are, which was, it's quite different. However, I would like to also just have a caveat around the on-the-ground work is still important. Connecting them to the chatbot, connecting them to the platforms, the other B-Wise platforms, using in-person interactions, activations, campaigns, and all that. And so what we've noticed is that even though the digital platforms really go far, and even though the paid media, as Sarah was saying as well, go far, it is important to find what the conduits between them reaching the digital platforms, the WhatsApp chatbot, is in order to really fill in that gap. In our own kind of anecdotal research, young people have talked about access to internet. We know in South Africa, for those who may not be in South Africa, that Issues such as load shedding, where we have scheduled power cuts, really speak to the challenges that young people might have not having a stable internet connection. However, we know there are interventions that are being done from an infrastructural point of view by government to really mitigate those challenges. And I think another one is looking through what it looks like to particularly reach young people within rural communities. How do these digital innovations reach them and are accessible to them? But all in all, even in our own activations and our own work that we've been doing on the ground, we've been really promoting the chatbot and ensuring that young people know how to access it. And it's always so fun seeing them really interact with it on like as immediately as they find out about it. But thinking about digital reach, particularly in this climate and with the challenges and even the positives that I've mentioned, it shows that behavioral change is not only something that can be done in the short term, but it's also a investment, a long-term investment that is required, that has to be also partnered with social mobilization on the ground.
Great, thank you so much. Quickly over to David. Love Life's Groundbreakers program is known for its effective use of peer-to-peer information sharing, and I know you've given a brief description on why it's important in your previous response, but thinking more generally, just how important is peer-to-peer sharing for platforms like B-Wise, and how can we continue to strengthen that mechanism on this platform?
Yeah, thanks again, Keith. Based on what I also said earlier on, peer-to-peer education sharing encourages participation and engagement as young people. They're more likely to interact with content shared by their friends and acquaintances, because what it does is that learning in a peer-to-peer setting can be more dynamic and interactive, because it facilitates better understanding and also better retention of information. Now, when you look at if I take it from a point of a social influence, right, the normal settings, what happens is that when peers advocate for safe practices such as condom use, right, what it does, it helps to set that positive norm within the group. And that social influence can be more powerful to motivate for a behavior change. And if we look at language and tone, if it comes from let me use this for lack of a better word, an older person's information, it's going to be like, oh, okay, no, but the peers speak relatable language because they often communicate in a language and in a tone that resonates with each other, making that information more accessible and more understandable. And also one of the big things, and I think for us, is that South Africa is so diverse. The cultural reference from a peer-to-peer led discussions is more likely to be culturally relevant, because it addresses specific issues and concerns that are pertinent within the group. And what happens is the youth empower each other, because that comes out from what we see from the ground, is that leadership opportunities actually come out, because there's peer-to-peer programs that we have at Love Life that empower young people to guide each other with learning, with leadership roles, because what it does, it boosts the confidence and also skills and communication with advocacy, as we've actually seen from what has come out from the research that has been done. And also, just one last thing for me, it's networks work for us, because information shared from peer to peer can spread rapidly through social networks and also reaching a larger audience more quickly than, let's say, our traditional methods for now.
Great, thank you, David. And Luis, back over to you for one last reflection. I think, Chris presented on a lot of the quantitative findings, but there were also very interesting qualitative findings that came through. For example, 67% of users shared that they would be a lot more likely to use condoms more consistently and 64% of users said they were planning to test for STIs more consistently than 5 months ago. Now, we saw that that didn't necessarily come up in the quantitative data. So how do you reflect on this from the foundation's perspective? And how can we use that information to help us guide maybe the next steps on this program?
Great. Thanks a lot, Keith, for the question. So I guess that the way that I read these questions, and probably my intervention will fit perfectly with what David was saying and Poncho. So the way that I read these results give me definitely a very optimistic perspective of the program. But I need to add here a caveat, right? Which is we can be optimistic, but being optimistic must come with ambition. Otherwise, it's just hope, right? So these results are telling us about intention, which is one of the crucial, and I hope that I don't go very technical here, but intention is one of the very crucial elements or components within when articulating a given behavior, and no matter what type of behavior. So if we look across different behavioral models, I would say that intention is the most common element when triggering, right, a behavior. So in a way, improving intention opens the door to a healthy seeking behavior and preventing practices, which is one of the ultimate goals, right? However, I mentioned before about these complexities around the behavior and the analysis, and the complexities of being an adolescent. So just think back in time when we were all adolescents, how difficult were those times, right? So in order to materialize these intentions into behavior, the next steps should be, in general terms, right, an attempt to cement an enabling environment that in which one can exercise behavior through decision making, right? There is also, however, something important to say here, which is the when we can observe changes. So investment, and this is something that I've been thinking a lot working in this sector. So investment is not only financial resources, but it's also time. Normally, organizations of any type, so it can be local, international, private, public NGOs, and I would also include donors. So want to observe changes in behavior now. And often the sector of behavioral change and the intersection with SRH program, so program timelines, budgets, funding lines, and evaluation efforts are, unfortunately, we must say, it's very constructed around a narrow vision of how long it takes to change behavior. So if we think ourselves on a given behavior that we actually tried in the past to change, so we would realize that it didn't take us just simply a year, right? And depending on what type of behavior, it could take way longer than a year. So the same happens in the area that we are working. So we cannot expect that this or any other intervention aiming to change the behaviors of the target population, we cannot expect that happen by tomorrow or now. So from the perspective of EJAF, we are aware of these challenges or the differences in times. And we try to accommodate our research and evaluations to timings where we can, I would say, give the opportunities of outcomes to be observable. So then my call now is to keep scaffolding the behavior change, and Reach Digital is on the right path, definitely, and understanding that time is key. Not observing behaviors tomorrow does not mean that the program is not successful. So it's inviting you to take your time to observe the desired outcomes.
Wow, great. Thank you so much, Luis. I love that contribution. As someone who is working on the evaluation of outcomes, the recognition that it sometimes takes a little bit more time is definitely refreshing and very much in line with how we're thinking. So thank you so much, Luis. I just want to also say thanks to all the panelists. I think it's very clear the diversity of minds that are at work in this consortium, given the different perspectives that were shared, ideas even already percolating in just this discussion. So I think, thank you so much everyone for joining. It's given us a lot of food for thought for how to proceed next. But for now, I'll hand it over to Gugu Makubo to open up the chat for quick Q&A.
Thank you so much, Keith, and thank you everyone for joining us as well as contributing. It's such a treat to have all you experts here. And if you can just allow us maybe 3 questions from our audience, feel free to jump in and answer whichever one. I see, Tabisha, you've been responded already. You asked about whether the platform was live already, and I see that Debbie's already responded and shared the WhatsApp link to you. Also about how it was marketed to target markets to ensure greater uptake. Who'd like to respond to that? Debbie?
I think Sarah's the expert in this area. I'm going to volunteer her.
And also, Sarah, if you can just add in your response whether the goal of the user recruitment was around 100K. So did you meet the goal or exceed it?
Thanks, everyone. Right. So, okay. So, yes, I think that we'll be able to add in after the meeting here on this as well. Yeah. So firstly, we did hit that target, which was incredible. So I think that, you know, as I mentioned earlier, there was a huge in-kind contribution from Meta that helped with that targeted ad posting. And I think it is, you know, it's a lot of trial and error. I mean, Avert does very successful paid targeted marketing. That was experience we were able to bring to the project, but without doubt, we learned an enormous amount as a result of doing this. But I think, yeah, it is that, you know, targeting the audience, understanding the audience's needs. I think it's already come up that, you know, meeting audiences where they are, which is, you know, a key issue when it's, you know, people, especially newer users to Facebook who are there for maybe, you know, more kind of social commerce type activity, and then they're getting an opportunity to talk about sex and relationships. If the ads are well done, they're lively, they're engaging, they're not educational, then you'll get a good hook. But it does take trial and error and practice. And then you can get, as we saw, hugely successful results from targeted ads. But obviously doing your audience profiling is essential, and then learning from the feedback you get. I'm not sure if my colleagues are still in the room, if they want to add a bit more to my actual colleagues who work day to day on this are in the audience. So I'll just see if maybe Yal or Mina want to add anything more into the chat that colleagues can then read from. But yeah, thanks.
Thank you. And they can also jump in and respond to some questions around the specific user engagement trend that you witnessed. Perhaps if you can just highlight when it was best to engage the youth, and whether or not the NDOH promoting the line on their Facebook generated better user sign-up. You know, compared to traditional Facebook advertising. I think there's really interest around that user engagement, those insights, and how Facebook played a huge role in generating good engagement.
Brilliant. Yeah, perfect. Thanks for that invitation. Let me see if my colleagues who were there day to day, so that's Yal and Mina, if I could invite you to jump in specifically on that. Are they there? Okay, so maybe just, we can definitely speak to this, but possibly it's best done. Let me just see, they'll need to use the, right. Okay, maybe if you move on, we're just going to get that, because you're right. This is a particularly interesting area. It's an area that, you know, does take polishing and responding to. So we're going to come back to you on that. Thank you.
Thanks, Sarah. And just generally to everyone, just so that you know, we will be sharing the recording after the session, and we'll make sure that we add all those questions and responses that we haven't been able to tackle in the session with that email. So it's not a problem. I don't want to spend too much time here, but there is definitely interest around the future of the platform, whether or not there's any ideas around expanding it to new countries. Can we have this be the last response before I hand over to our next speaker? Is this Debbie? Did you unmute? Please, can you tell us?
Yes, I voluntold anybody else. I'll take this one myself. We don't want to roll things out and scale them without good evidence that they work. And as Louise said, there's still work to be done, but we are very optimistic about the results so far. And so we are now looking to expand into other countries. Some of the priority countries for us are Nigeria, Mozambique, Zambia, and Tanzania and Rwanda. And we are primarily focused on the African continent, but if you have interest in expanding this into other countries, please do reach out to us, because we do think that given the results that we've seen now, it's prudent to start scaling it to other youth.
Thank you for that. And if there's no other input from our panel, I'd like to introduce Dr. Lindsay Hayden from EJAF, a great supporter of the work. And Lindsay is the Youth Portfolio Lead. Over to you to share your thoughts on the platform.
Gugu, thank you so much. And thanks to all the panelists, organizers, etc. Really phenomenal work. I'm going to speak very briefly, just to say, the way that sort of the Elton John AIDS Foundation came to this work was we know there's a lot of incredible work being done around youth, but we also know that there's a huge gap. And particularly when you look at SRH outcomes and certainly HIV outcomes, adolescents are just fundamentally falling behind. And so we knew we needed new approaches. Again, we weren't the first to come to this. Reach Digital, others were certainly the giants in the room, but there was a real recognition that we know, young eyeballs are already online. And I think what was really unique about Reach and their combination with NDOH, Soul City, Love Life, all the Avert, all these incredible partners, was this recognition of, if the eyeballs are already on existing social media platforms, let's literally meet youth where we are. I know we hear that a lot in sort of other programming, but this program really delivered on that. And it wasn't expecting young people to genuflex or change their life in any way to get the information and access the services that they needed. And so it's really just been an incredible thing to watch. I, at least from my vantage point on the African continent, have not seen anything at this scale. I think it's just been amazing to see both, quantitatively, we've seen improving SRH knowledges, we've seen improving, attitudes around consent. We've seen even like some improvements in condom usage among certain young people. And we even saw sort of a decreasing proportion of users screening as having high mental health risks. And, that's quite amazing and definitely an incredible foundation to start from. And in addition, we've seen that the content on this platform really resonated with youth because we listened to youth and there was an iterative feedback about what was resonating, why was it resonating, the fact that the platform became more bespoke, the more the user used it, the more they were likely to continue engaging. We know there's more work to be done, but I think EJAF are incredibly bullish on continuing to push this forward in South Africa and possibly further with all their incredible partners. So I just want to say thank you so much to this entire consortium. You've done a phenomenal job and exceeded, I think all of our expectations. And with that, I am going to pass back to Debbie.
Thanks so much, Lindsay. For those of you who are sticking with us, I know we're running a couple of minutes late. Thank you so much. I am the last speaker and I'll be closing out. I just wanted to say, if you want to go fast, go it alone. And if you want to go far, go together. I think it's been absolutely amazing to have such incredible partners in this journey. To Avert and Soul City and Love Life, who have really made a lot, the advertising, the helpline, the Facebook page, all of the elements possible. Obviously for the financial support from the Elton John AIDS Foundation. And then most importantly for the leadership and guidance from the National Department of Health. There are very few governments I know of who have such an advanced view of how to engage with youth via digital channels and the type of platform that B-Wise is. And so that definitely is something that has made this the success that it is. So thank you so much to our colleagues at the National Department of Health. And then last but not least, thank you to the all of the attendees. We will send through information after this. If you have any further questions, there is a very, very long and detailed report for those of you who are interested in all of those details. And we thank you for joining us today. And if there's anything else we can help you with, please do reach out to us.